Hello everyone! In this video I will show you how to use a 3 and 4-dimensional ultrasound to assess the levator hiatus and the anal sphincter. The patient should be in lithotomy position with flexed and slightly abducted hips. The convex transducer should be covered with a glove. To visualize the levator plane, the transducer should be placed on the labia in sagittal view as shown on the left. The acquisition should be performed with a wide opening angle, allowing the visualization of part of the symphysis pubis, of the urethra, of the vagina, and of the anal rectum, as displayed on the right. This is the so-obtained view. The transducer is at the top of the image. The patient's front is on the left, and the patient's back is on the right. This is the symphysis pubis, the urinary bladder, urethra, vagina, inner rectum, and puborectalis muscle. When we perform a three-dimensional acquisition, we can visualize the levator ani on the coronal plane, shown on the right. Imagine you are looking at a woman's pelvis from between the legs, from the bottom. The symphysis is at the top. The puborectalis has the form of an hammock, surrounding urethra, vagina, and anal rectum. In this clip, the woman is performing a pelvic muscle contraction. During contraction, we notice that the puborectalis is getting closer to the symphysis and that the levator hiatus is getting smaller in the coronal plane. This is a sequence with an intact puborectalis. This instead shows avulsion on the right side. Additionally, the compliance of the pelvic floor muscles can be assessed during maximal Valsalva maneuver. Again, we identify the symphysis pubis, the muscle, and the pelvic floor structures. During Valsalva, the increasing abdominal pressure determines the distension of the levator hiatus. In 2D, we see that the puborectalis gets farther from the symphysis. In coronal view, the surface of the hiatus increases. These clips illustrate a pathological overdistension or ballooning. 3 and 4D ultrasound can be also used to assess the anal sphincter. To do that, the transducer should be rotated by 90 degrees and placed on the fourchette, as shown on the left. This transverse acquisition allows the visualization of the anal complex. This is the 3D acquisition obtained in multiplanar view. The external sphincter is hyperechoic, while the internal sphincter is anechoic. In this clip, the woman is performing a pelvic floor muscle contraction. The external sphincter is squeezing, and this enhances its hyperechogenicity, so that it's easier to discriminate. Contraction is recommended to evaluate sphincter integrity by tomographic ultrasound imaging. Thank you for watching.